Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, everyone. This is Doug Nelson from the Massage Therapy Foundation, and welcome to another episode of Research Perch. In this Perch episode, we are revisiting an earlier episode that we did on some research that is being done at the University of Indiana, Indiana University School of Health and Human Sciences at Indianapolis. And we have two guests who were on the previous Perch, Dr. Niki Munk, who is an associate professor at Indiana University, and also one of her students, a board-certified massage therapist, Mica Rosenow, and discussing assessing effective measures in the 2020 pandemic. So welcome to both of you, and I want to do just a little bit more of an introduction, and if it's okay, Dr. Munk, we'll start with you.
Great, thanks so much. Thank you very much for inviting us back to be able to talk about this. I want to very briefly focus on me, but main focus is going to be on Mica and her work. Mica is a doctoral student in our doctoral program for Health and Rehabilitation Sciences. And this is a project that she's working on likely for her qualifying exams. An opportunity arising that would certainly inform our field and certainly the folks who access massage therapy. So the great work that she is doing and allowing her to talk about that work and the progress and continue to recruit is really, really helpful. So thank you so much for this venue and this opportunity. Mica?
Yeah, so thank you for that little introduction. I have been practicing massage for the last 10 years. And in doing that, I've always been curious about the different aspects of how massage affects our clients and then how massage therapists affect, or how doing massage affects the massage therapists as well. So I decided to pursue my PhD with Dr. Munk at Indiana University, Purdue University in Indianapolis. And like she said, this is probably going to be my qualifying exams. So understanding how it's the ins and outs of the research and that kind of stuff whenever it hasn't really been a focus in the massage education that I received has been amazing to kind of go through and work with other massage therapists who are starting their journey in research as well, and being able to kind of help and answer questions for them as they're trying to participate in this study has been a really great opportunity. So thank you again for having us back.
Well, I cannot wait for the day that I can say, Dr. Rasdon, could you please, so that day is coming. So, you know, I think for all of everyone who's viewing this, and maybe some people, it's either been a little while since they saw the last episode or they have not seen it. So could we talk a little bit, Mica, could you talk about the assessing affective measures study and just recap what it is and the intents and purposes?
Sure. So as practitioners, we day-to-day understand that the way that when we put our hands on someone, it affects not only their physical being, but also kind of how they feel about themselves and the things around them. And it really helps with their affective perspective in life. So dealing with anxiety or depression or those kinds of things, we understand that massage probably helps with that as well. And the research is leading to that. Mm-hmm. So with COVID happening and hitting kind of everything all at once everywhere, it shut everything down. And that aspect of us being able to connect with each other or just reaching out to our massage therapist to get treatment for our pain and those kinds of things was immediately shut down. Mm-hmm. So I'm looking at the difference between people who continued to seek services when they were available where they were, and the people who were not allowed or able to continue seeking services throughout from September to about now.
Wow, wonderful. You know, it's such important research. And what's really cool about that is, you know, there's other research focusing on practitioners, but this really does look at our clientele in a really interesting and I think it's going to be a really important study once this thing is published. I think the last time we had this conversation, you were looking at recruiting, and I know we had different targets that we were looking for. Where are we now in terms of the number of people who participated in that study?
Great. So we were shooting for around 500 and we're about halfway there. We've had participants from 20 different states and 2 different countries. So that's pretty exciting as well.
Wow.
We are still recruiting and we'll be recruiting through the rest of this month.
The way that we're recruiting, of course, the people who are completing the research and filling out the surveys and the like are potential or current clients of massage. But the way that we are recruiting them is through massage therapists. So it's if a massage therapist is seeing clients or are able to see clients, they are inviting folks who are coming to see them to enroll in the study. And then we're able to look at whether these folks have received massage in the past or if they're receiving massage for the first time. And it answers some really interesting questions potentially on people's motivations if they've never had massage and now they're seeking massage during a time which might be considered very potentially risky or in these very additionally stressful times. So we're able to look at affective characteristics of those who have had massage in the past and those who haven't, who are seeking massage. But then also massage clinicians who may or may not be seeing clients or have clients who aren't coming, inviting them, people that are already in their clientele list, to participate in the study. So it's almost using a bit of a PBRN approach, as the practice-based research network approach, even though we don't officially have a PBRN established at this point, but it's using the practitioners to invite their clients to participate in the research, and it keeps the patient information from going through the researchers. So it helps with privacy and the like.
Yeah, it's so interesting. So I think, just to be clear, what participation means, and this is a survey that people fill out. Is that correct? And is it just once? Does it happen a couple times? What is the time frame with that? What kind of commitment would a client be signing up for in a way?
So the initial assessment or the initial survey takes about 10 to 15 minutes, depending on the person. That's going to be asking you questions about demographics and just kind of your background and your history with massage. And then it gets into the second part, which is the affective measures part. Mm-hmm. Every time you take it after that, it's just the affective measures part. So it cuts it down to about 5 minutes for most people, less for others. It just depends on how quickly you read. Yeah. But you can take that as many times as you get massages. So you can take it every time you go in, or if you provide your email information whenever you do your initial survey, then I send out a follow-up survey invitation once a month for those people to fill that out, whether or not they have sought services.
So, I think certainly what comes to mind for me is, so everyone who comes to my clinic, we have an email newsletter that we do every month. And I know we sent that out to my clientele, but that's the people who are coming. But for therapists who are not practicing right now, this again seems to be a great way to connect with the people who were your clients. If everything is on pause, this is a way of still keeping that connection going and letting them know that we are thinking about them and still concerned about their health. The other thing is, therapists always ask for a way, like, how can I participate in research? Guess what? This is a fabulous way to do it and engaging your clientele at the same time. That just seems like a home run on every account.
Yeah, and I actually had an email just a couple days ago come in asking about if there were going to be specific action plans after this. And that's the take home of all of this, is that the more data we can get to understand these things and the more massage therapists that we have that present these opportunities to their clients, the better information we're going to be able to pull from that. So if I have one massage therapist who has only 5 of their clients filling out the survey each time they come in or each time it's sent to them, and I have the one in every state, that's quite a few people that we have enrolled, plus a lot of different massage therapists who were involved also. So, I mean, in a way, this is a really good way to get started because it's pretty low stakes. You just ask your client to fill out this survey, give them the link, and they can participate if they want to. They don't have to. So it's just a way for you to offer them something that everyone can be involved in to help better our understanding of what massage is and how it helps people.
And just to note as well, there is a time ending point. So once somebody enrolls at baseline, they won't be invited or asked past 3 months. So they can continue doing it as many times as they receive services within that 3 months. But then after that 3 month time period, that's when the longitudinal aspect of the study concludes. Is that correct, Mica?
It is. And it's 3 months from your first survey. So you'll get an invitation every month for 3 months. So this cohort that comes in March will receive an April, May, and June invitation, but they can fill it out as many times as they want to in between those times. It's up to them how much they participate, but it's asked that they participate at least once a month from the time that they start their initial survey.
That's not a big time commitment, which is really wonderful, actually. You know, this is not never ending, and also the thing itself doesn't seem like it's, you know, if it's 10 or 15 minutes, that's really wonderful. And you know, the other thing that strikes me in listening to both of you is, if I am that therapist, and I am, and I'm asking our clientele to do this, to participate in research like this, I think it reflects really well on both my own practice and on the profession in general, that we are self-reflective, that we are curious, and that we are looking to support what we do with data, and in the effort to serve the public better. I think that's a wonderful reflection on us and the profession.
I agree.
Yeah, and you know, I'm sorry, that's the motivation behind all of it, is to better understand what's going on right now, because that separation between individuals in an immediate sense caused a lot of panic for everyone, and a lot of people are still going through that. So just being able to connect and then give ways for us to understand our field and our discipline better throughout that is really important for everyone.
You know, it's that to better understand translates into better serve.
Absolutely.
Yeah. Wonderful. Anything else that, you know, it just seems to be, if this is the time window, it seems like the door is closing in about a month. Is that right?
It is.
Yeah.
Yes.
So in terms of people enrolling, and then when they enroll, like in the next 4 weeks, they will, you know, they will be enrolled for the next 3 months, right?
Yes.
Yeah. So
well, what makes this point kind of interesting as well is, we know right now in society, with the vaccines rolling out and the like, this is a very different environment than sort of the first wave that we had initially. And because there is sort of a nice defining point of efforts for this section, and this is sort of the last month that we'll be doing this recruitment, and then we'll have it through June, while there's these other pieces that are changing, we're actually creating another analysis opportunity, a subgroup analysis opportunity, with this particular recruitment cohort versus earlier recruitment cohorts that have already actually finished. So we've already got opportunity for cross-sectional analysis when we group all the baselines together across the board and take a look at that based on whether they've had massage experience in the past or not, or the level of massage experience that they've had in the past or not, or other factors that would make logical sense to examine, whether that be age, older adults or younger adults, or the like. But then also being able to look at these in these very specific recruitment cohorts would be interesting as well.
Is so fascinating. And I didn't think about that yeah, when we had this conversation before, the context around the conversation was very different.
Everything was still shut down.
Yeah, and it just, I'm so glad that you mentioned that. I never even thought about that people who are starting now, it's a very different contextual environment, and just the opportunity for you to have yet another piece to examine, compare, and contrast is just another reason to get people, let's take this last month and really do a push and see how many people we can do before the study closes.
Indeed. Well, and that especially those folks who've never had massage therapy before. So folks who are seeking massage therapy for the first time, as things are opening up, that's a really interesting context to be able to look at. Now, granted, we're not going to be able to, with it being cross-sectional, particularly with the baseline, we're not going to be able to make causation conclusions from that analysis, but we can certainly start generating some really meaningful and important hypotheses that we can later specifically design research to answer.
It's so interesting. It's so fascinating and meaningful and impactful for the profession. So anything in closing that you want to add?
No, just, keep pushing it out there. Get involved. Like I said, this is a low stakes involvement. All they can do is tell you no. And most of the time they're just going to say, yeah, I'll take the link. And that's all you're going to know about it. So I know that in the beginning of my career, I was really nervous about starting in research because it seems so overwhelming. But once you get started, it can kind of turn into something a lot bigger. So I hope you will present this to your clients and get involved as well.
Amen to that. So for all of us, so we have a kind of a 4-week window. So we want to push this out as much as we can. So share this with your clients. We will put a link in, however you're watching this, we will put a link so that you can easily connect with this survey. Share it with your clients. Let's see if we can get it to that 500 participant level. All right. Deep thanks to both of you for such important work in the field. I can't wait to see how this turns out and to see the insights that it provides. So thank you to both of you.
Thank you.
All right. Thanks everyone for watching this episode of Research Perch through the Massage Therapy Foundation.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.